Good morning. Welcome to our webinar. We are WH Medical, and this is our webinar on getting into medical school. We hope you're all well, and it's great to see so many of you have logged in and registered on this Saturday morning. My name is Dr. Ahmed, and I'm joined by my fellow tutor, Dr. Butts. So we've got a packed hour for you, where we're going to go through the overview of the process from start to finish on how to get into medical school. We'll also have a question and answer session at the end. So just to give you a bit of orientation, so to the right of your screen, on the right side panel, you should see several tabs. There's a chat function on there. So if you've got any questions, comments, or any answers you want to give to questions during the presentation, pop them in there and we'll get to those at the end. You should also be able to click on the offers tab for buying access to our 1,000 question Ucat bank. And in addition to that, in the chat function, there's also a link for our full day course on getting into medical school. And feel free to check that out at some point. So let's make a start. Right, WH Medical, we are a specialist medical training company and we are all practicing doctors. We offer courses from getting into medical school right the way through to teaching postgraduate doctors, so doctors that have already qualified but need to pass their postgraduate exams for further practice. And we also run courses for international doctors that want to practice and work within the United Kingdom. And one thing we always say at WH Medical is we always aim for excellence. Now, a bit about us. My name's Dr. Waheed Ahmed. I attended the University of London and the University of Manchester. So throughout my career, I've had experience in a number of different specialities, from surgery to rheumatology, emergency medicine, pediatrics, and rehabilitation medicine as well. My main job is I'm a GP partner in one of the largest practices within Birmingham. And in addition to that, I've also worked as an examiner for doctors that want to practice within the UK. For they have to undertake a clinical assessment exam, which is essentially a more rigorous form of the mini medical school OSCEs. And I'm also a tutor and director here at WH Medical.
Hello everyone, and my name is Dr. Haroon Butt. I studied medicine at the University of Bristol. And over the last 12 years, I've had experience in a range of settings, as with Dr. Ahmed, ranging from acute stroke medicine, trauma orthopedics, emergency medicine, and general practice. As Dr. Ahmed, I'm also a GP. Unlike him, though, I'm not a partner. I'm a portfolio GP, and I work in a range of settings, including out of hours, and I'm also a prison GP. I've also developed a specialist interest in minor surgical procedures and am now studying towards my own postgraduate diploma in dermatology. Like Dr. Ahmed, I'm also a tutor and director here at WH Medical Courses.
Right, so what are we going to cover today? So the most important question is, what's it really like to work as a doctor? Because that's very important, because if you're going to apply for a course such as medicine, you need to know what it's like. What grades are required? Medicine is very competitive. Different routes onto the course and which course you should choose. We also go through Youcat, so what the format of that is, and Bmat. Ucat and Beamout, we'll get to this in more detail later, but are essentially exams that you have to take prior to, within the year of application to medical school. We'll also do, we've also got a section on personal statements, as well as interviews and mini OSCEs. Right, so what's it really like to work as a doctor? So when people think of a doctor, they think of perhaps a surgeon. You still have to go to medical school, do your undergraduate 5-year degree prior to wanting to specialize as a surgeon. But you can do you can undertake different forms of surgery, obviously, so from brain surgery to orthopedic surgery to cardiac surgery to lung surgery to general surgery. There's lots and lots of things that you can do with a medical degree. Does anybody know who this famous but fictional doctor is? So it's actually Dr. House. Medicine is not quite like what Dr. House makes it out to be, because he only ever has one patient, but an interesting series nonetheless. Or this could be your day job, working as an emergency heli doctor. So you could potentially be an emergency medicine doctor that works as part of the heli services team. And you could be a rescue, giving immediate care to patients that perhaps might be critically unwell on the side of on a cliffside, or somewhere quite rural and remote, or at the scene of a major trauma. So this could potentially be your day job from a day-to-day basis. So there's a famous quote: if you choose a job you love, you'll never have to work another day in your life. So if you really enjoy medicine, then it's great, because it's a career that you can get paid for. Now, a question everyone needs to ask if you're going to apply for medicine is it right for me? Now, we would say it's probably one of the best jobs you can ever have. But it is important that you understand that commitment is essential. It takes a long time to train as a doctor. It takes 5 or 6 years to qualify. And then that's just to get your medical degree. Then after that, it's postgraduate training. So if you want to be a surgeon, for example, you'd have to do your foundation training and then postgraduate training beyond that to eventually become a consultant. Or if you want to be a cardiologist, or if you want to be an emergency medicine doctor, there's still postgraduate training that you have to do. And medicine is one of those careers where lifelong learning is required. You're always learning new things. So medical school is just one part of it. You'll then go on to develop your skills and specialisms throughout your career. One of the important things is, are you a problem solver? Can you think like a detective? And the reason I say that is because people will come in and the same overall disease may present differently. So people may come in with different symptoms, but you still need to get to the right diagnosis. So can you think like a detective? There's lots of different things that you have to use, lots of different skills you have to use to try and get to the right diagnosis. And are you interested in people? Medicine is a career where you have to be in contact with people. Clearly, it's bettering people's lives. It's diagnosing illness, and you have to communicate with people in the best way that you can. And obviously, you'll be taught that in medical school, but it's very helpful if you are naturally a good communicator. Now, like I said before, there's a wide range of specialities, up to 60 specialities potentially to choose from. So you can be a brain surgeon to an infectious diseases doctor. Medicine is one of those careers that can take you anywhere in the world. So I've known doctors that have worked as expedition doctors for research teams that might be, at very exotic places, in the middle of a jungle somewhere, or you might be part of a research team in the Arctic, or perhaps you might want to do charity work, or for example, you may want to get involved in virology or epidemiology, infectious diseases, for example, or there's lots and lots of different things that you can choose from as a speciality. Now, that in turn gives you a lot of job satisfaction if you enjoy and have a real interest in your speciality. If you improve someone's life, if you save someone's life, there's an immense amount of job satisfaction within that. And in addition to that, there's always job security. As a doctor, that you can work anywhere in the world. It's a highly respected profession, and it's relatively well paid as well. Now, what's a day in the life of a junior doctor? So imagine you've just qualified, and you're working on, you've got a normal day that you would have as say you're in a particular speciality. So what you would normally do is you'd normally do a ward round in the morning with the consultant. So you'll go through all of the patients that have been admitted onto the ward. You'll go through their history. You'll go through examination, and you'll come to a possible diagnosis. You'll treat what the underlying condition is, but they may need further investigation. So, for example, you may need to request certain scans. You might need to do some blood tests, maybe some additional things like putting in an IV line. If dependent on which ward you are, you may do lumbar punctures under the supervision of a more senior doctor. You might be putting in chest drains depending on where you work. There's lots of different things that you would do during the day after you've done the ward round. You may then liaise with other doctors and specialities. Say, for example, you're on a cardiology ward, you're a junior doctor in the cardiology ward, you may then have to speak to doctors from the general surgery ward or from other specialities. During your day, you might have a new patient that's come into the ward. You then need to make sure that you clock them in, and by that I mean you would need to find out why they came in. You need to summarize their medical history, prescribe all of their regular medications, and start a management plan. You may then need to deal with emergencies on your ward, and if it's a medical rotation, so by that I mean if you're in cardiology or respiratory or what we call a medical role, you might possibly have outpatient clinics as well, where you can join some of the more senior doctors for their outpatient clinics. If it's a surgical rotation, again, you might have time in outpatient clinics, but you may also spend time in theatre, with the more senior doctors to assist in surgery. Now, we also have more posts on, more detailed posts on a day in the life of a GP, a day in the life of a working as a locum doctor, surviving night shifts as a junior doctor. Those are all found on our page, whmedical.co.uk. Feel free to visit that webpage for all details on our courses and more of our blogs as well. Right, so applying to medicine. So the medical course, applying for a medical course itself is very competitive. So almost 24,000 applications and just under 7,400 places. So there are 37 medical schools in the UK. You spend 5 or 6 years at university. So dependent on whether you want to do an additional degree in the middle of your medical degree, that might be 6 years, or if you go for the pre-medical year, you apply through Ucat. You can apply, so from your Ucat choices, you apply to 4 medical schools out of 6, with the last 2 places potentially for other courses. Now, one of the things I would advise is sometimes people use the additional 2 places for courses like dentistry. That's not recommended. So the other 2 places could be for perhaps biomedical science or pharmacology or pharmacy perhaps. Or potentially, you could leave those blank as well. But it's good to have a backup plan for the last 2 places on your form. Now, if you do the 5-year course, there's usually split into 2 sections. So you do the 2 years pre-medical course. So that is essentially learning about all anatomy, pharmacology, all of those things about disease processes. But a lot of the anatomy and the initial courses is is taught within the 2 years section prior to the clinical section, which is when you go on to hospital wards and you learn about disease processes. You spend a lot more time in hospital in the final 3 years of your course. Now, once you graduate, there's further training, as I've mentioned before, that's dependent on what you want to specialize in, and that's the length of additional training or postgraduate training is variable depending on speciality. So in terms of GCSE grades, now these are minimum requirements. So you would need a minimum of level 6 in English and maths. So most universities want between 5 and 7 subjects. If I know this is variable dependent on which school that you're at, but individual or separate science subjects are preferred. If not, then double science is acceptable. And most universities require at least a grade 6 in science. And these are minimum requirements. And medicine's very competitive, so the actual grades achieved by successful candidates are going to be higher. Now, A-levels. Now, chemistry, most medical schools accept a full A2 for application. Places where chemistry isn't always offered, it might only be offered at S-level. Biology is usually then required at full A2 level, but usually the chemistry is what's required at full A2 level. One other subject, physics or maths. Think carefully about your third subject, because what you want is essentially, if you've got crossover knowledge that you can apply from one subject to another, that will help you do better on all of the subjects. General studies and critical thinking isn't accepted. And the typical offers range from A star AA to potentially ABB. And ABB may be for students that perhaps might be part of a widening access to medicine scheme. And that's essentially, there's a few schemes similar to this, but essentially if you're a resident of a neighborhood that perhaps that has less participation in higher education, or you're estranged from family members or carers, there is the potential, some universities have potentially could give you a lower offer if you're part of that scheme. And remember, it can sometimes take time to build up to an A grade. Now, if you don't have the correct subjects at A level, then there is an option to apply for what we call a pre-medical course. This is a 6-year course. And so essentially, this is the standard 5-year medical course with an additional year at the start called the pre-medical year. Now, that can be, dependent on which university it is, that can be a standalone course at some institutions, or it can be part of the a run-through. As long as you get through that pre-medical year, you can then go on to the standard 5-year course. Now, there may be some people that have logged in today that might be graduates. So there is the potential for graduate entry. This is only obviously open to applicants who have a degree. Usually only takes 4 years. So there are 14 medical schools that offer this route. So some require a science-based degree and others don't. So say, for example, you may have done biomedical science, for example. You could then apply for graduate entry, but you need at least a 2-1 degree in most institutions. Now, you still have to do the Bmat or Youcat test, or depending on which university it is, you may have to do something called a Gcse exam. You need relevant work experience, but you also need a strong personal statement. You need to explain to the admissions tutors why you want to become a doctor as a graduate. Because clearly there are challenges, as if you are looking to spend another 4 years at university, having already spent 3 years as part of your degree. Now, Ucat. This is the University Clinical Aptitude Test. So this was previously known as the Ucat. Now, this is a 2-hour computer-based test. Now, it's a requirement for the majority of UK-based medical schools. So that's 30 out of the 37. So It's a multiple choice based exam. So this exam is sat from July to October in the year that you apply to medical school. So say you're applying next year, you would have to sit that exam from July to October. Now, it is a very important exam because some universities put a lot more focus on Ucat than others. So, for example, Bristol University, they would have 100% Ucat weighting, so assuming that the other minimum criteria are met. For Manchester University, for example, if you apply it to Manchester, if your score is within the top third of scores nationally, you'll be invited for interview. Assuming you've reached the minimum criteria. Again, that's important. St George's University, you need to score more than 500 in each section, and Ucat is used to rank people for interviews again. So Edinburgh University considers the situational judgment section, that's a part of the Ucat exam, separately. So different medical schools put different thresholds, different minimum thresholds prior to shortlisting. So some may shortlist the top few percent, others may use your Ucat score as part of your entire application. But what is the underlying message here, that yes, it is absolutely important to get a good Ucat score. Dependent on which university that you want to go to, it'll be more important for some more than others. Now, the exam itself is made up of 5 different sections. So the first section is verbal reasoning. Now, you've got 44 questions. Remember, this exam is about 2 hours. So 44 questions, you've got 21 minutes. And this is your ability really to essentially critically evaluate information that's provided for you in some text. And you then you'll be given, we'll go through an example of this in a few minutes. And then you then have to answer certain questions. Decision making, now that's your ability to interpret statistical information, we'll draw conclusions, evaluate arguments. Again, we'll go through a question on that. You'll have 29 questions on decision making, and you have 31 minutes. So the next section is quantitative reasoning, and this is ability to interpret numerical information. So you'll have 36 questions and only 24 minutes. So you only have around, on average, in some parts, less than a minute per question. And abstract reasoning, that's the ability to understand, ability to identify patterns among shapes. You've got 36 questions, 24 minutes of this, and the situational judgment is the ability to understand real-world situations. Now, for that, you'll have around 22 seconds per question for situational judgment, and 69 questions on this. So it's important you practice Ucat questions, because these need to be second nature to you by the time you do the exam, because it's such an important examination. Practice is key. Okay, so let's start off then. So we'll go through a question on each of the 5 sections of the Ucat. Okay, so what I'll do is, if I give you a minute for the first one. So, right, let's have a look. So, verbal reasoning. All right, so you've got a minute. If everyone wants to read the passage. Okay, so hopefully most of you have read that passage. So this is the question. All the MB stations broadcast their programs live. So is it true, false, or can't tell? So you can pop your answers in the chat section. What you think it might be, A, B, or C. So let's see what the majority of people think. Okay, so the answer is false. So because it says the text says the program is broadcast live over most NBC stations. Okay, so right, seems lots of you did get that right. Right. So the next section. So decision making. So again, you've got around about a minute for this. Okay, so hopefully most of you answered. It seems to be B. Seems to be what most people are answering. Let's see if you're right. Yes, well done. So that's the reasoning. Oranges bottom as the fruit with the greatest number of letters. Apples are at the top. Jam is right above oranges in the list. So it's one up from the bottom. Rest are placed in alphabetical order from top to bottom. So it's bread, eggs, milk. So that's the order here. Apples, bread, eggs, milk, jam, and oranges. So milk is right above jam in the list. Now, next one, quantitative reasoning. So you are going to need possibly a calculator for this. So just give you a minute. Okay, answers. So pop them in the chat section. Okay, so most of you got the right answer again. Oh, it seems to be a bit out of sync, but yeah. So what usually what we need to do is work out the swim in minutes. So there's 15 seconds in minutes. So that's 15 divided by 60, which is 0.25 minutes. Total number of minutes is 31.25. You then divide the time taken swimming by the proportion of time that's represented by swimming. So 31.25 divided by 4, that's 7.8125. You add up the ratios, and then you multiply the swimming proportion by the whole ratio, which is 7.8125 times 56, and that's 437.5 minutes. So the correct answer was C. Okay, so this is abstract reasoning. So you don't have much time for this, only 30 seconds. And put your answers in the chat. Okay, so I think most of you got the right answer. So yeah, I mean, this is answer was B. The black triangle moves twice to the right with each pattern. Now we do have more detailed abstract reasoning questions and verbal reasoning questions on our question bank, but this is an important one, which is situational judgment, because this is the one often lots of people may struggle with or find more difficult than others, because it's not there isn't always what we call a scientific answer, either yes or no answer. It's about judgment of the situation. Now, the way you would answer for this example is with very important, important, of minor importance, or not important at all. So these are the 4 choices you've got as answers. Okay, so very important, important, of minor importance, or not important at all. Okay, so this is you've got the text, and at the bottom is how important is the following factor. So you've got 1 minute. What does everyone think? Okay, so hopefully most of you have worked out. So there's a range of different answers here, which is which is interesting. So yeah, full range of answers. So the correct answer is it's not important at all, because if you go back, Georgia will have finished her placement by the end of the week. How important is that? That's not important at all, considering the situation, because here it's about patient safety. So Georgie, it's important that Georgie confronts the doctor and raises the concerns with a senior clinician and seeks to resolve the issue because patient safety might be at risk. Because in medicine, patient safety is absolutely paramount. So the fact that Georgie is due to finish at the end of the week isn't important when patient safety issues are concerned. Okay? So the answer was not important at all. Now, I did mention before, we offer an online Youcat package from $9.99 for over 1,000 questions with worked examples and explanations. And early preparation is key. So we've got offers for 3-month access and 12-month access from all the way from 2 weeks right the way through to 12 months access. Now, the key is with Youcat questions is practice. Go through questions once and then go through them again, because that's where most of your learning will be. So you can click on the offers section and book directly. So where the offers tab is, to the right of your screen, and that'll take you directly to our booking page on our website, or you can use this link at the bottom here. So whmedical.co.uk, book-Youcat-online. So early preparation is key for this. Right, so the Bmat test. Now, this is a 2-hour pen and paper test. So there's no calculators, dictionaries, or dictionaries. So there's 3 sections. This is just just not lined up, but there's 3 sections. Critical thinking, problem solving is the first section. The second section is applying scientific knowledge. Now, the scientific knowledge is up to GCSE standard. Can you apply what's given to you and understand as part of the exam and apply and answer questions in that respect? And you'll also, the third section is essay writing, one of 3 subjects. So you'll be given 3 subjects and you have to write an essay, which is again, some people find challenging if they're more mathematically minded. Now, the Bmat exam is usually held twice a year in September and November. So in 2020, obviously with everything that went on with COVID, there was only 1 sitting in November. The key differences between Ucat and Beamout is that you receive your results around 3 weeks after sitting the exam, once you do Bmat. Obviously with Ucat, you'll get your results, or you'll get your score before you leave the examination room. So, and one of the things is with either Ucat or Beamout, you can only sit the exam once a year. So you've got 1 chance that year. You can't sit it again. So there are the 7 universities that require Bmat. So 7 out of the 37. So if you want to apply to Cambridge or Oxford, University College London, Imperial, Lancaster, Leeds, Brighton or Sussex, you would have to do the Bmat. The rest you would have to undertake Youcat. Okay, so right. So over to you, Dr. Butts.
Thank you, Dr. Ahmed. So first thing I just want to say is that we're 45 minutes in, so I am mindful of the time. Dr. Ahmed is very thorough in these presentations, as am I, so we may run over a little bit, and I hope that's not a problem for anyone. So I'm going to talk a little bit about personal statements to start with. Now, the personal statement is something that people can become very worried and anxious about, but essentially, the personal statement on your UCAS form is a chance to support your application to study medicine. It's a chance for you to demonstrate your abilities, your ambitions, to give the course tutor, the admissions tutor, a flavor of who you are as a person and what you've done in order to fulfill your ambition of studying medicine. So you're aiming to use the statement to tell the examiner why they should offer you a place to study medicine. The place I normally recommend candidates start with is reading course descriptions. So whichever university you're applying to, there will be course descriptions for medicine. Have a read of those descriptions. Then head over to the MSc website, which is the Medical Schools Council website, to have a read of the key qualities, traits that are commonly found in a doctor and they look for when they're selecting candidates. So that those things will help you sort of start towards thinking about your personal statement. In terms of structure, generally speaking, people tend to recommend you look at these three subsections within your personal statement, which are motivation, exploration, and suitability. So you start with your motivation. So why is it that you want to study medicine? Why do you want to become a doctor? What is your motivation for this course? Then you move on to exploration. This is a section where you can now set out all the things you've done to explore medicine as a career, to explore this career in terms of the various options such as hospital medicine, or if you've done your work experience in a GP surgery. So that's where your exploration comes in, along with your extracurricular activities, wider reading. So those things you will talk about in your exploration. Then you're going to finish with suitability, which is where you talk about how suitable you are as a person for this course, having done all the things that you've done, having had all your experiences, having looked at the MSc website. So why should they essentially offer you a place? I highly recommend at some point just Google the University of Oxford Anatomy of a Personal Statement. It's a one-page document where they've taken a personal statement of a successful candidate and they've dissected it quite nicely. And it gives you an idea and an insight into the mind of the admissions tutor and what they're thinking about and what they're looking for in a personal statement. So I'm just going to go into these in a bit more detail. As I said, motivation. So why do you want to study medicine? You can't just state that I like science, so I want to study medicine. You have to prove your motivation. So you have to go deeper than saying I like science. Well, why do you like science? What is it about science that catches your interest, and what specific reasons are there for you to want to study this course? And this requires reflection. So a lot of people won't necessarily know why they want to study medicine specifically. So it's about sitting down and actually genuinely thinking about it. And reflection is a key skill that all doctors possess. And Dr. Ahmed and I, to this day and to the day we retire, reflect regularly on our practice. We have to put that on our GP portfolios every year, which is reviewed by an appraiser. And you have to show evidence of continuous reflection, continuous learning, and continuous growth. So it's really good to get into those habits early on. As always, we always advise avoid exaggerations. Don't exaggerate your motivation. Don't exaggerate your experience. Avoid cliched statements. Avoid humor. Avoid opening with a quote. These sorts of things are a risk because it's down to how the admissions tutor reads them. If he's having a bad day, he might not be best pleased to read a humorous quote on there. So it's a risk that I'd say isn't worth taking. And obviously avoid slang and colloquialisms where possible. Well, always, not just where possible. So as I said, we'll go through a couple of examples of what I said with motivation. You've got motivation, such as the first statement, I love science and people, so I want to study medicine, which is okay. That's a valid reason to want to study medicine, but they want to see a bit more depth than that. So what is it about science and people? For example, you're saying the same thing, but with a bit more depth to it, such as I love the way the human body has inbuilt mechanisms to regulate everything from temperature to blood pressure control, and how doctors can intervene to correct faulty systems. So we're talking about negative feedback systems here, which you will have undoubtedly read about in your biology A-levels. And by doing this, you're giving specific information about what it is about medicine that you are interested in, whether it's empathy, whether it's the communication skills. So make sure you have a really good think about that. So again, you could look at motivation such as, during my work experience, I shadowed a doctor and I was inspired by him to apply for medicine. Well, why were you inspired? What specific experience did you have, and how did you reflect, and what did you learn from it? Which is what the second statement does. So during my work experience, I shadowed a doctor who had to give a patient some distressing news. I was impressed by the way he approached the subject with a demeanor of calm confidence, displayed empathy, warmth, and sincerity. And I'm excited at the prospect of developing these skills further myself to help my future patients. So over here, you're taking the experience that you had, you've explained what that experience was, and then you've relayed it and you've linked it back to the medical school council attributes found in a doctor, and you've also then gone and said that actually I do possess some of these qualities, and this is a chance for me to hone them further and develop in a personal and professional manner. So as I said, exploration is your chance to provide evidence that you've explored this career, you've done everything possible, which in 2020, 2021 is limited. So we'll go through that in a second. So essentially you have to provide evidence that you've explored a career in medicine. Now, there are many ways of doing that, such as work experience, volunteering, community work, but none of these are truly essential, especially this year. You've also got wider reading, which we'll come on to in a bit, in a short time. As with anything, as with the theme of everything I've said, don't just provide a list, reflect and show evidence of learning. What is it that you did, and why was it important, and what did you learn from it, and how will that help you in your future degree, and what did it teach about yourself, for instance? So yeah, so that's the last point. What did you learn about medicine and about yourself from that experience? Now, work experience will be different for different people. Therefore, the things you take away will be different. If you're part of a multidisciplinary team, that's more, you're looking at skills like team building, communication skills, teamwork. If you're working in a GP surgery, if you've had your work experience there, then it's more empathy, talking skills, communication, breaking bad news. So the things you will gain will depend on what your setting is. Display an understanding that you realize medicine isn't a straightforward, simple, easy sail through career with lots of money, 9 to 5, and a big yacht. It can be a tough career. It's a long degree. And there are sacrifices that we've all had to make as doctors. There are missed birthdays, there are missed weekends, there are missed family events, weddings, because you're working night shifts, weekends, whatever else it may be. So understand that this is a career that shapes your life, and it's not a career to take lightly. So this is where you're showing that your exploration has taught you valuable information about this career, but the upside and the rewards you get are worth it. As you've already said, don't exaggerate your work experience, because you'll get found out. When you go to interview stage, when you go to the mini medical interviews, they will ask you specifics about your work experience, about your wider reading. And if you have exaggerated, then that will reflect poorly upon you. And one of the key skills of being a doctor is probity and honesty. So always keep that in mind. Now, the thing about your work experience in this year especially, this is the key point. You're not being assessed on the quality of your work experience, but what you've gleaned, what information, what knowledge you've gained from it. So someone could work in a tertiary liver transplant unit where only 10 people have ever had a work experience, but they didn't learn anything from it. Or they didn't display any learning on their personal statement, as opposed to another candidate who was with a local GP for a few days, but he had some meaningful experiences, he or she had some meaningful experiences, they reflected on them, and they've listed them in their personal statement as to how this has helped them in making this career choice further. So as I said, there has been a huge impact on your ability to gain work experience, and medical schools know that, universities know that, the Medical Schools Council knows that. In fact, I'll come on to a document that they've released this year, which you will benefit from reading as well. But remember, it's an even playing field. It's a level playing field. All candidates are in the same situation as you. The key theme here in my whole presentation so far is one of reflection, learning, and thinking about what's going on around you and awareness. Has anything happened this year? Let's think about 2019, 2020, 2021. Has anything big happened this year in terms of medicine that has been in all of our minds at the forefront? Of course there has. Doctors and health professionals have been main media news. Dr. Chris Whitty has been on the television every evening for best part of a year, before which no one knew his name. And the things that we've learned from seeing these medical professionals, you can show a lot of learning, evidence of learning from reflecting upon the year. Think about social media. So there's so many doctors who are posting information about COVID vaccines. Think about misinformation, which is a big problem at the moment. How do you think this is going to influence the future of healthcare? Think about BAME communities and BAME groups and what are the issues there. Think about health inequalities and how these can be addressed and what can be done in these regards. So there's so much stuff that's happened this year that you can learn from. And you don't have to have been sitting in with a GP to have those experiences and to have had genuine learning experiences. So think about your extracurriculars at this point as well. Non-medical interest can be added. I wouldn't put too much on your extracurriculars. You can mention them, but try to list them back, try to link them back to your application and why you want to study medicine if possible. Again, you're going back to the MSc list of attributes for a doctor, and you're going to try and link your extracurriculars to that. So there are several resources that you can look at this year in terms of exploration. Like I said, yes, you can't get a face-to-face GP work experience, but the RCGP website has got an interactive platform aimed at A-level students called Observe GP. If you Google that, it'll come up. You can register, and it gives you, it highlights different aspects of life in primary care, and is a really good, useful tool, which has been designed specifically for A-level students looking to apply to medicine. Brighton and Sussex Medical School have a virtual work experience course. You could click onto that as well. WS Medical Courses, we're doing a course this summer, a day in the life of a doctor. As we said earlier, myself and Dr. Ahmed have 20 years of experience of working in the NHS between us across in excess of 15 specialties. So there's a lot of experience there that we can share with you, which you can then reflect upon and take your own experiences from those as well. So if that's something you'd be interested in, drop us an email and we will forward you information closer to the time on that course as well. So yes, medical work experience has been difficult, but there's lots of voluntary work this year as well, equally. Think about all the elderly people in their houses and all the volunteer work that's been going on in terms of helping with deliveries. There are websites like Do It website, Nextdoor website. You can log on, you can sign on as someone who's happy to help and volunteering. And you can then display skills like empathy, teamwork, honesty, organizational skills from doing voluntary work as well. So the final subset in your personal statement will be your suitability. So this is where you're going to round off your personal statement and tell the reader, so why is it that you're suitable to study medicine? How do you get them to make that conclusion? And as with everything, you're going to prove your suitability with evidence. Don't list your qualities. Don't just say that I'm very empathetic and I have good communication skills. Well, hopefully you've demonstrated these already. So you're now going to talk about why they should offer you a place at their university to study their course. What is it that you possess that will make you a good doctor, and what qualities can you bring from your life outside medicine so far to your degree to help your profession? And as I've already mentioned, have you weighed up the sacrifices against the rewards and fulfillment? Not economic rewards, not financial rewards, but rewards in terms of patient outcomes, in terms of helping save lives, in terms of bettering other people's time on this planet. So there are rewards of many types. So the question is, what is your motivation? A few do's and don'ts for your personal statement. Always try and demonstrate and display your strengths. Be concise with your wording. The wording is limited. You can go onto the Ucat's website and all the information is there about how many characters and lines, etc. you're allowed. Avoid extravagant and flowery language. Start your personal statement early and be patient. You'll make a draft and you will change it and you will change it again and again. And that's normal. Don't be frustrated by the process. Share your personal statement with trusted family members. Share it with your teachers. Once you're happy with it, start proofreading it aloud, because that's how it will come across to the admissions tutor. So read your personal statement and proofread it aloud as well. As I've already said, avoid humor, avoid quotes. I guess this goes without being said. Don't buy someone else's personal statement. Don't pay someone to write it for you. Don't copy someone else's statement. The UCAS website has a software when you enter the personal statement. If there's more than 10% similarity with other statements, it will get flagged up. And as I've already said, probity and honesty and integrity are key skills of being a doctor, and so you need to demonstrate these. Also, try not to read lots of other people's statements and example statements so that you can approach your statement with an open mind, with a blank sheet of paper, and you can make it your own because you're trying to show who you are as a person. Okay, so next we're going to look at your multiple mini interview. Essentially, this has replaced the traditional interview from many years ago, and it's a series of short, structured stations. So almost like what we would call an OSCE, which is a type of exam that you'll have throughout your medical training and in postgraduate years as well. The stations can last anywhere from 5 to 8 minutes, so they vary from university to university, and the entire exam can last from anywhere from 40 minutes to a couple of hours, depending on the university as well. Generally speaking, each station is trying to focus on one central theme. When you are given your question or your scenario or your reading material at the start of your station, you have 2 minutes reading time. Use that, and we'll discuss how you use that in a few minutes. And the university, so the number of stations will vary. Now, people think, again, that the multiple mini interview can be quite daunting. Well, the way to think about this is it different or similar to traditional interviews? And the answer is it's both. There are differences, but there are also similarities to traditional interviews. The main differences are the fact that it's multiple stations, which is actually a benefit, because if you're someone who doesn't have a good first impression sometimes, if you're anxious or nervous on your first station, well, you've got that out of your system after your first mini interview, and you go into your second and your subsequent ones more confident, more relaxed, more sort of yourself, essentially. Whereas in a single interview, that first impression can be really important, so you have multiple chances to make that first impression. The other difference is that there'll be timed stations, and you'll be moving from station to station. It'll be one-on-one, as opposed to you'll be sitting in front of a panel of examiners, which again, I think is less daunting, a one-on-one chat with someone. And I suppose a mini interview gives them a chance to assess you on a wider range of skills and attributes, and equally gives you a chance to show off a wider range of skills and attributes, because it's a more of a global assessment and a global view of you as a candidate. So if there are certain things you're not good at, but there are other things that you're very good at, those things will surface, and the examiners will find those positives in your style of consultation, talking and communicating over the course of this mini interview. There are multiple types of stations. There's role play stations, data analysis, conversations, breaking bad news, angry or irate patient. So, on our full day course, which is listed in the link, we go through this in much more detail. As you can imagine, both myself and Dr. Ahmed really like talking. This was a 1 hour webinar. We're already over that, and we could go on for several hours still. In terms of similarities, so yes, there are definite similarities with a traditional interview, in the sense that not all of these are stations. Some of them will be an interviewer sitting with your personal statement, having highlighted 4 lines, and they'll be talking about a particular experience that you've mentioned in your personal statement, and they'll go through that in some detail with you. So in that sense, it can be quite similar to a traditional interview as well. And obviously the line of questioning will be similar to traditional interview in these sorts of stations. As I said, the topic can vary. I ran out of space on this slide. Otherwise, I could keep going. I could add another 10, 15 different types of stations on here. And there's nothing out of the ordinary there. It's all the kind of stuff you'd expect to see in a mini interview. So as with anything in life, preparation is key. If you've never done a mini interview before, this can be an extremely daunting and an extremely scary situation to find yourself in. Whereas if you've done many interviews and you've practiced it and you've done it again and again with friends on a course, you know the layout, you know how your brain works, how to approach the station and what structures you use, then it becomes a lot more straightforward. But essentially the point of each station is to assess your ability to read the information provided, process the information, and then in that time apply structure and logic so that when you start your consultation, you're able to resolve the situation through communication. You'll have to learn how to multitask, and the ability to think while speaking and while demonstrating active listening is a skill. And active listening in itself is different to just listening. This is something we go through in a lot more detail on our course as well. And if you haven't had the preparation, think about any presentation you've ever given. When you haven't prepared and you haven't stood in front of a mirror and presented several times, it comes across as anxious, you come across as fidgety, we all do. And lack of preparedness will always surface as anxiety, and that will make you suffer in terms of your score overall from the MMI. So practice lots of different scenarios. Make sure it's always under time pressure. Set a timer for, say, 8 minutes, and do that again and again so that you sort of know what 8 minutes feels like, which I'll mention in the next slide as well. Practice with schoolmates, practice with family members, anyone. Have lots of different people giving you stations and scenarios, because you'll come across different styles and different ways of thinking as well. I'd also suggest doing a mock interview with multiple stations. So you can do a mini exam with 5 different stations and go around each station with 8 minutes to sort of get into the groove of doing a station, finishing it, putting it out of your mind, moving on to the next station. So with the MMI, the goal is to understand what each station is asking you. So what key quality is it assessing? And always try and relate back to, as I've mentioned several times, the Medical Schools Council website, attributes of a doctor, because that is central to your application. And when you're reading that, the blurb that you're provided at the start, that in the 2 minutes in your reading material, start to anticipate what sort of questions you'll be asked. What sort of demeanor will the actor probably have? Is this one where it's an angry person I'm talking to? Then expect that person to be angry. Don't be surprised when they are. And as always, don't get thrown off. Stay calm, stay collected, stay cool. If you suddenly go blank, if you're in the middle of a station, don't know what to do, just take a breather and actually just summarize everything that you've found out so far. So you're summarizing the last couple of minutes, what's been said, and that gives you 30 seconds, a minute to just calm back down, just to refocus your mind and remember what you're going to do next. So we talk about things like that and many other little tricks and things that you can do to help you in these scenarios, especially ones where you're a little bit stuck. So when we do our one-day course, we do a run-through of an MMI as well. Essentially you're talking about a panel of doctors, myself, Dr. Ahmed, Dr. McCulloch, who's one of our colleagues as well, who isn't here today. Between us, we have several decades of experience of multiple medical specialties. And I was talking to Dr. Ahmed earlier, and I was trying to work out how many mini medical exam interview type exams we've done over our careers, and it's in excess of 10 each. So this is a style of examination that we're very familiar with, and Dr. Ahmed has actually taught this particular type of, he's actually examined this particular type of interview as well. So you'll be gleaning insights from an examiner essentially as well. So let's see. Yeah, so we have a structured approach that will teach you, and it'll help you hopefully pass every station, every scenario. And you'll be able to take this approach, as I said, through medical school OSCEs into postgraduate exams as well. The principles remain the same. I'd also suggest working on time management. Like I said, know what 8 minutes feels like. Run all scenarios to time. On the day of your multiple mini interview, wear a watch. Make sure it's a digital watch, so you can time yourself during the station as well, as opposed to a very cool analog watch, but you can't tell the time on. So you want to be able to know exactly when the station started and when it's going to end. Learn to pick up cues. There are verbal cues that a patient will give you, and those will give you hints, and those are clues as to where this scenario is supposed to go, and address them as you go. They can offer you vital information which is relevant to the scenario. Like I said, key themes of becoming a doctor. Some of them on the MSc website are the ability to remain calm under pressure, dealing with uncertainty, and communication skills. The MMI, just by concept, is testing those 3 all the time. So you're constantly being assessed in these scenarios anyway. So your ability to stay calm and focused can be the difference between pass and fail, a place at a university, or not being offered a place at university. Learn to compartmentalize. Once the station is over, it's over. Don't think about it. Move on to the next one. Whether it went well or poorly, you need to learn And this is a learned skill, the ability to take that, put that aside and think, right, I'll dissect and analyze later. I've got to move on to the next scenario. And yeah, it's a learned skill, and practice, as with everything, makes perfect. So we've got a couple of multiple mini interview type scenarios. How are we doing for time? Okay. So we'll go through these very quickly. So you've noticed your housemate at university has become increasingly withdrawn in recent weeks. He confides in you that he is thinking about leaving university as he's struggling with his mental health and asks you for advice. So in your reading time, that's not going to take you 2 minutes to read. That's going to take you all of 15 seconds, 20 seconds. So why are they giving you 2 minutes to read that? Think about the Ucat question Dr. Ahmed had. That was far more information, and you had 1 minute to read, process, and answer the question. The reason you have 2 minutes reading time is so that you can analyze the words on there. Everything is there for a reason. Try to anticipate what sort of questions are coming your way, what sort of things are going to be asked by the interviewer. So use those 2 minutes. And yeah, again, what are the key traits the examiner is trying to assess? And what is the core competency that is being assessed here? Think about a real world scenario if you've got time, where that may be similar. What did you do well? What would you have done differently? Take that experience into the interview scenario. Essentially, this particular scenario is it's trying to assess your ability to display empathy, to have effective communication. Are you able to display good listening and speaking skills? Are you able to do problem solving and help resolve this issue after listening to your housemate? So if they're asking you how you'd approach this situation, you're going to talk about the use of open questions, open body language, discuss using an approach that we use all the time called say what you see. When someone looks upset, you say, you look really upset about this. If someone looks angry, I'm really sorry, you appear very angry about what's happening. So you're acknowledging what the patient is feeling, which validates the way they're feeling, and that helps develop empathy and trust, and it makes that a safe space for them to communicate with you as well. Talk about the use of silence, because in this situation, your housemate may need you to just listen. He may need a few minutes to get all that information out, so where possible, give him time and space to be able to talk. And then ask around, say that you'd ask around the statement provided. You try to get a global view of what's going on with your housemate. How are things with his course? How are things at home? How's family? And there could be any number of things that could be triggering his current symptoms and his mental health problems at the moment. Suggest that he speaks to family members or a course tutor. In terms of resolution, offer to go with him to his tutor if he's feeling anxious or if he's feeling stressed out about approaching them. And that's, again, you displaying empathy. So second one, you're a GP and your next patient is Samantha, 51-year-old lady who's been diagnosed with rheumatoid arthritis. Internet research tells her bell peppers are the best cure for rheumatoid arthritis, and she doesn't want any prescription drugs from the specialist. She has come to you for advice. Again, you have 2 minutes. So what are the key themes here? This is about misinformation. This is about patient choice. This is about your capacity consent. So basically, if the patient has the ability to make this decision, then they are allowed to make whichever decision they feel is correct for them. But your job is to give them current advice based on medical expertise without ridiculing, without belittling the patient or anything along those lines. So understand where you are, who you are in this setting, what options you have available to you. Again, use open questions. Try to understand the patient's story. Invite them to tell you what's going on. Why is it a choice between these two options? And why is the patient picking the option they are picking? Try to understand their motivation behind what they're saying. Again, pick up on cues. So Dr. Ahmed and I always talk about ICE. ICE is ideas, concerns, and expectations. Again, something we go through in great depth. Explore the patient's ideas, their concerns. Are they worried about side effects? Has someone in their family had problems with similar medication in the past? What are their expectations from bell peppers? Do they expect to be cured? Do they expect that their symptoms will just stay under control? So once you have a lot more information, then you have to give some advice. Ethically speaking, what are your responsibilities in this situation? And what would you advise them? We don't have time, unfortunately, for me to create a poll on that today, but these are things we will go through in a bit more detail on the course. So final thoughts. It can be a daunting process. In an hour and 15 minutes, we've given you an absolute whistle-stop tour of the application process. But it doesn't have to be a daunting process. With the right guidance and support from family, from teachers, from an education provider like us, the aim is to help make this process as simple, as easy, and as stress-free as possible. Develop a timetable for the next few months, and that depends on where you are, year 11, year 12. Try and get a big calendar, stick it up on your wall, and write on there what your goals are. Break it down into small sections. Start practicing for your Ucat questions. Find out if you need the Bmat for the universities you're applying to. Start reflecting on why you want to be a doctor. Do you want to be a doctor? Start working on exploration and suitability. Start practicing MMIs after that. Once you've really made your mind up, then start practicing for MMIs. Join a course like ours and enlist help of family members, teachers to help prepare. And in terms of the Ucat, book our question bank. It's 1,000 questions. You can get, I believe, a 1-week access for £10. And that will give you a flavor of our questions. And if you like them, you can rebuy, you can extend, you can continue using that question bank for longer. Consider joining us for our upcoming courses. As we've mentioned in the chat section, we have a link to our upcoming full-day webinar. We've got our Ucat questions as well. Follow us on social media. We periodically put information on our courses out as well, along with educational content. On our website, we've got some blog posts on what it's like to be a doctor, how to survive a night shift as a junior doctor. If you head to our website, there is stuff there already that you can look at. Also, have faith in yourselves. You are smart, clever, educated young people with a lot of skill, and this is something that is not unattainable. With the right support and with the right guidance, this is something that is very much attainable. As always, I'm a big believer in self-care. Make sure throughout this process you're looking after yourselves. This has been a tough year for everyone. Think about the isolation, COVID, everything that's been going on, the anxieties that this year has given us. Last thing you want is to make yourselves even more anxious by thinking about all of this and making yourselves ill. So make sure you're doing your self-care, looking after yourself, exercise, healthy diet, preparation, prepare early, get in touch with us, speak to your school tutors. And when you start early in anything, you take away the pressure and you reduce your stress levels as opposed to cramming everything towards the end. Most of all, good luck, best of luck. Whatever you do for your future, we expect you to be leaders in the future, and we'll be hopefully seeing you guys soon. Thank you. Apologies for speeding up so much at the end. I did have to get through all this content. So we can now look at any questions. I believe there have been questions coming through over the course of the last hour and a bit.
I think there was one that mentioned what's a high Ucat score? So depends obviously on what scores everyone else is getting, because you'd be ranked against everyone else that's taken the Ucat. But just to give you an example, so the top 10% in 2019 got 2,800, okay? The top 30% of students got 2,610. And the top 50% got 2,480. So that's where you need to be in terms of scoring systems. There was also another question, I believe from Amy, who said, "Do you have paper to work out answers in the Ucat test?" You don't have a pen and paper. What you do have is a physical erasable whiteboard. If you sit the test at one of the Pearson View centres, or you have a scratchable, you have an on-screen scratch pad that you can use. As well. We also had another question about what do you base your judgments on for the situational judgment section of the Ucat. So it's a difficult question, I suppose, because there's so many different sources. But usually there's obviously the 4 pillars of medical ethics. That's autonomy, justice, beneficence, non-maleficence, Professionalism is the other one. You need to know what it means, what professionalism means, how to work as a professional, what consent means, teamwork, communication, what empathy is, how to display empathy. Good resources, the GMC, Good Medical Practice, that's the core of how doctors advised what good medical practice is. Now it's a longish document, but you can briefly summarize that if you read through it. So I would certainly recommend you look at the GMC Good Medical Practice guidelines, and for certain scenarios, discuss with peers, other people, get other people's point of view. Because I think it's important to look at a broad range of views, so you can essentially reflect on what the answer should be. So find out what other people think. It's often good to get an insight of other people's thoughts. So a lot of these situational judgment test type questions, you need to practice these as well. So a lot of it is from practice, because it'll be the same themes that recur in a lot of questions. So there was another question.
So Waheed, I think Ali's done a quick summary of all the questions at the top of the chat. I don't know if you can see that.
Oh, yes. Yes, here we go. So let's have a look. So how long does it take to be a pediatrician? Oh, good question. So you would need to do 5 or 6 years of medical school. So that's 5, say you have 5 years. You then need to do 2 years of what we call foundation training. So that's a rotational training where you work in different specialities. So you're a practicing doctor, but you do 2 years as a rotational. So you may do 4 months. You'll do 4 months in different specialities. And that's to get broad-based training. After that, you'll then have to apply specifically for pediatrics. So you're already at year 7, so 5 years of medical school, 2 years of foundation training. So you then apply for pediatrics. So you then work 7 or 8 years in pediatrics. And along the way, you will be doing certain exams, pediatric exams, they're postgraduate exams. And as you become more senior as a pediatrician, with the end game to be obviously to become a consultant, so you'll have 7 or 8 years training and 2 years foundation training. So that's a total of possible 9 years, 9 or 10 years post-qualification. And then you've got 5 years at medical school. So 14 or 15 years before you become a consultant. So from the point of graduation, so from the point of application and getting into medical school, you're looking at around about 15 years or so before you become a consultant.
So there's a question on here as well. When should I start revising for the Ucat and Beamout? I believe general advice, and Dr. Ahmed will know more about this. General advice is for the Ucat, it's about 6 weeks of solid preparation time. And the Bmat, again, 6 to 8 weeks would be the general advice in terms of preparation time, because you have to practice the questions, you have to practice the format, you have to practice the way that you have to think with these things, which is slightly different. So I'd certainly give it 6 to 8 weeks in both.
I would say, yeah, that would probably be a minimum. I think really you need to, depends on how much you want to prepare. Some people may start their preparations a year early, because if they've got lots going on, if they've got lots of coursework, if they've got lots of other things, extracurricular activities, depends how much time they want to, whether they want to spend all their time cramming, or is it going to be a case of spreading out your preparation, and also looking at if there are skills that you need to develop, giving yourself a little bit more time to develop those skills. So it depends on how good your score is and what your baseline is. So if you've got lots to improve on, then clearly you need to start earlier and prepare earlier. If you've been doing lots and lots of reading and you're very good and you're a mathematician, you're excellent at a broad range of subjects, then of course you may need less time. But 6 to 8 weeks is the minimum, but you may well start, up to 12 months earlier. It depends on what you've got on and what type of preparation you need.
It's very true. It is dependent, isn't it, on your underlying ability as well and how prepared you are. Next question there is, if I'm applying this year, when should I start on my personal statement? So there's, again, no right or wrong answer, but what I would say is, when a personal statement is done quickly or last minute, it is apparent. The admissions tutors will read it and they will know how much time you've spent on your statement. Because you have to remember, these guys have been doing their jobs for decades and they've read thousands of personal statements. So there's a lot of expertise there. So the longer you spend on it, the better it will be. Think about all the things I spoke about very quickly with regards to reflecting and showing evidence of learning. So the longer you reflect, the better that reflection is, because the deeper that reflection is and the more meaningful it is. So start doing drafts for not the whole section, but maybe say, okay, I'm just going to start on my motivation for now and see if I can figure out my motivation and get it down succinctly in a few sentences and show it to people. Break it down into chunks, do it bit by bit. Don't try to do the whole thing now and try to then redo the whole thing again. Roughly how many stations would there be in an MMI? So this is university dependent. Some universities, it could be as little as 4 or 5 stations with a 40-minute MMI. And I believe there are a few MMIs that were a couple of hours. So there's no right or wrong answer for that question. It just varies. But if you're prepared, it doesn't matter how long it is. If anything, the longer it is, the more you're going to shine because you're better prepared. So the longer the MMI, the better you will do, essentially, is the way to look at that.
There was another question. Will taking both Ucat and Beamout, though difficult, widen the chances of getting into university? Yes, potentially, because depends on which universities you've got your heart set on. So remember, there are 7 universities that require Bmat, and if you want to apply to one of those, then of course you're going to need to take the Bmat. But the others obviously want Ucat want the Ucat exam. So if you do both, you may be more suited to one of the exams, the Bmat exam, than you are, to the Ucat types or style of questions. So you could potentially do both. There is some crossover, although they are different exams. There is some crossover between the two, and you can once you've got your score. So say, for example, you do Ucat in August, for example. If you do that, so you've got your score. Say you've got an absolutely brilliant score, you've got an excellent score. You then know that if you definitely wanted to get into university, to maximize your chances, it's better to apply to those universities that have a heavy weighting on Ucat. And the inverse, obviously the opposite is true, where if your score isn't as good as you hoped it would be, but you've got a brilliant personal statement, you've got excellent experience, you've got great GCSEs, then of course you would then perhaps look at those universities that don't necessarily put such an emphasis on Ucat. So you can tailor which medical schools you need to apply to. And similarly, you may have done really well on your Bmat. So Bmat is typically the scoring system is slightly different for Bmat, but say half of candidates, half marks, typical Bmat score is 5. The best candidates would get 6. There's a few really exceptional candidates that might get 7. So say you're one of those candidates that get 7. So it's best to apply to those universities that want Bmat. or you can see which of you've done better in your Bmat compared to your Ucat. So you can then again tailor which universities you want to apply to. So it's dependent on how you tailor your application, and if you tailor it correctly, you maximize your chances of getting into medical school. And are you allowed a calculator in the Ucat exam? You're not allowed your own calculator. The Ucat have when you sit your Ucat exam, you have your own. They give you their own calculator, which you need to use. We've got a similar calculator on our Ucat course as well, just to give you a bit of familiarity with using it on the real exam.
So the next question on here is a very important one. How do I sign up for the WH Medical one-day course? And the answer is in the sticky message at the top, and the link was also in the chat at the start of the webinar. If you tap on that link or click on that link, it will open up a new tab, which will allow you to register and book the full-day course. As I've already mentioned, we have a lot to say on this, and we could go on for hours. So please come and join us, and we'll look forward to doing that with you guys as well. So, next question is, will we get disadvantaged if our GCSE grades were based on teacher predictions, i.e. those who were meant to take GCSEs in 2020? The short answer is no, not at all. This is a global, worldwide pandemic, and again, you have to remember, everyone else is in the same situation as yourself. So COVID-19 wasn't specific to you, it was everyone. So everyone's GCSE grades are affected. So when it comes to year 12 and 13 and you're applying, they will not be thinking this year we're not going to offer anyone a place in med school because they only have predicted grades. So I wouldn't worry about that.
I think one of the key factors here is what medical schools want to do is trying to find the people that will be most suited to become doctors in the future. So that's why the Ucat score may well be very important to differentiate between those students that haven't had a chance to demonstrate their full abilities from getting what they thought they should have got for their GCSE or A-level grades. That's why it's important to have good personal statements. It's important to have all of those experiences where you're able to reflect, as Dr. Butt mentioned, in your personal statement, that you really understand what it's like to be a doctor. You understand, that it's long study, why you can demonstrate your motivation to be a doctor. A personal statement is important, and of course, the Ucat and the Bmat scores are going to be important for you to let the medical schools know that you're an excellent fit for their medical school and that you'll make an excellent doctor. Any more questions?
I think that covers everything. And
Right, so hopefully we'll be seeing some of you soon. And if you have any questions in the interim, feel free to email us on info@whmedical.co.uk. More than happy to answer any questions. Feel free to visit our website, whmedical.co.uk, and follow us on social media. What we'd also be grateful for is if you could leave us a review on Google Reviews. If you just Google WH Medical Courses, leave us a review on there. And if you want to be updated with all of our upcoming courses, feel free again to email us so that we can add you on to our list, to our registrants.
Especially the Day in the Life of a Doctor course that's coming in July. At the moment, we haven't yet put the link on our website, so people who are interested, please do email us.
Best of luck for your applications.
Take care, everyone.